This week on Monday Morning House Call, we're talking about acid reflux, of course, that made famous by Ashley Simpson during her lip-singing adventure.
Yeah.
But it is actually a serious thing. We need to deal with it seriously. Tell us a little bit about it.
Acid reflux is when you have like your stomach contents, they're not digesting properly, and they kind of reflux up into your throat because they cause a burning sensation or a bitter taste in your mouth. And you usually notice this like between 30 and 60 minutes after you've eaten a meal.
So those are signs and symptoms. Is there anything else that you might notice?
Well, you'll find that if you elevate your head or if you're up and active
Right.
after you eat, you usually don't notice those symptoms. But if you go lay down and watch TV after you get done eating, that's when they're most severe. And if you're having these symptoms, more than 2 times a week, that's when you're noted in the severe case of acid reflux. That's when you probably need to go to the doctor and get treatment for it. There's several medications now.
And to reduce the possibility of acid reflux, obviously go to the doctor and he's going to tell you certain things.
Right. He's going to ask a bunch of questions, and by your account of symptoms, then he's going to say, yes, this is what it is, or no, we need to do further testing. But more than likely, just by that first visit, he's going to diagnose you because this is something fairly easy to diagnose. And if the medication treats it, then we know that that's what it was. What you want to do after you eat a meal, this is some things to kind of reduce the problem. You want to, like I said, avoid lying down directly after you eat. Try to sit upright for at least 3 hours after eating. And if you do need to lay down, make for sure that your head is elevated. That way it doesn't run right to your throat. It can cause some major irritation in your throat. I've even seen patients that start coughing up blood that it erodes the throat so bad. You want to avoid any kind of acidic foods, spicy foods, citruses, coffees, stuff like that that's kind of burns your stomach when you drink or eat them. That's also going to burn your throat when it's coming back up.
Definitely.
If you lose some weight, that takes some pressure off of your stomach, doesn't push it up as far. That could relieve it without even medication sometimes. And decrease your meal portions. Eat small, frequent meals a day instead of eating one big, huge supper per se.
Right.
Or you could eat earlier in the day so that way you're not laying down directly after you're eating. And then take maybe some Tums, antacids, or something like that after you get done eating.
Christy, thank you for stopping by.
Thank you.
As we're getting into holiday season, eat a little bit less and eat a little bit smarter. We'll see you next week for more Monday Morning House Call right here on Mountain News This Morning.